Pulp Out dental burr was a burr that was used for performing a root canal on a molar tooth. It's a round-ended dental burr with a plastic guard attached to it. The plastic guard prevents the burr from drilling down too deep into the tooth. The idea behind this burr is when a dentist starts a root canal on a tooth, they need to drill down into the main nerve space of the tooth. This space is called the pulp chamber. The dentist that invented this burr found that on average the pulp space is a little over 6 millimeters below the cusp tips on a molar tooth. So they designed the plastic stop to be 7 millimeters from the end of the burr. That way the cutting head of the burr will be in the middle of the pulp chamber. The plastic guard helps prevent perfing out the bottom of the tooth during the root canal access preparation. Perf is short for a perforation, basically drilling a hole out the side or bottom of the tooth where there shouldn't be a hole. Prior to this burr, dentists would just drill by feel and by judging the depth of the pulp chamber on an x-ray. So this sounds like a great product, right? Every dentist who does root canals will be using it. Well, not exactly. Most of the time, teeth that need root canals are not in the best shape or they are covered with a crown. For those teeth, you can't use the pulp out burr since the landmark it needs, the cusp tips, are missing. It's even stated in the instructions to not use the burr in those situations. You can still use them as a regular round burr, but just don't use the plastic drill stop in those situations. But they are more expensive than a traditional round burr, so it would make more economic sense to just use a traditional round burr. In addition, the pulp out burr is only meant to be used on back teeth, molars and premolars. You can't use it on canines or incisors due to the angle of the tooth surface. I first bought some pulp out dental burrs at a dental convention because they seemed like a neat idea. I used them a few times, then switched back to using conventional dental burrs for my endo access preps. They must not have been a big seller for the manufacturer since they no longer sell them. I have a few other items that look great at dental conventions, but later on I found that I didn't use them very much in my office. I've since become more careful about impulse purchases at dental conventions. Has anyone watching ever made an impulse buy and end up not using the item? Let me know down in the comments. Thank you all very much for watching and see you in the next video.